I think my favorite part of being a physician is not only the patient care, I think it's actually the opportunity to work with people who are dedicated to what they do. It goes from top to bottom. Some people in any field are very dedicated to what they do, and I've had the privilege to work with quite a few of them. And it doesn't necessarily have to be physicians. It can be a caseworker, a social worker. It can be housekeeping. But wherever I've been, I've found people are dedicated to what they do. The very first patient that I saw in the office here was a patient that lives in the region and had surgery in the region a year ago. She went on vacation within a couple of weeks after that surgery to South Carolina. While she was there, she developed an infection of her spine. She was treated at a facility in South Carolina for 2.5 months prior to returning to Ohio. Once she returned to Ohio, she actually was then referred to OSU, and ultimately she was seen at Genesis a 1.5 years later. I had access to all that information within a minute, and that's something that absolutely would not have happened 10 years ago. What I would hope a patient and a family would know when they walk into the office is that I've done the background work. What I typically do is the day before a patient comes to the office, I will review their chart. If it's a new patient, I've been through their records. I've seen what may have happened even 3 to 5 years ago. And I'll have as much knowledge about what has happened before they step foot into the office, so that when they're in the office, my focus can hopefully be on what their questions and concerns are beyond just the medical issue. Clearly, it's important to get to know not only the patient on a personal level and to some degree the family, because the family is who helps provide that patient's care as much as any of us do. That's part of the reason I spend time before I ever enter a room knowing as much of that person's medical history as possible.